All right, get ready because today we're diving deep into some pretty intense medical cases.
Oh, I'm ready.
These are all about pulmonary emergencies, stuff paramedics deal with every day.
You got it. Real life scenarios, every second counts.
We've got a whole stack of case studies that you, the listeners, have sent in.
Yeah.
And we're going to break them down, figure out what's going on, see how paramedics approach these situations.
Awesome.
So by the end, you'll have a much better understanding of how to recognize respiratory distress.
Mm-hmm. And what to do about it.
Exactly. So, you ready to get started?
Absolutely. Let's dive in.
Okay. Our first case takes us to a home in Sudbury, Ontario.
All right.
22-year-old woman, let's call her Sarah.
Okay.
Having trouble breathing for the past 4 days. Paramedics get there, find her in the what they call tripod position.
Oh, yeah.
Leaning forward, hands on her knees, gasping for air.
Classic sign of respiratory distress. You see that tripod position, you know it's serious.
Really, like that's a big red flag.
Absolutely. It means her body's working overtime just to breathe, She's using every muscle she can to try and pull air in.
So the case study says Sarah has a history of asthma and was recently prescribed a new medication. Could that be playing a role here?
Oh, for sure. Asthma, airways narrow. It's like breathing through a straw, and a new medication, especially if not taken correctly, it could definitely make things worse.
So paramedics are thinking asthma. What do they do next?
Well, they'd listen to her lungs, right? And they're going to hear things like shallow breathing, decreased breath sounds, especially at the base of her lungs. And they're going to hear wheezing when she exhales.
Okay, yeah.
It's that whistling sound, like a balloon that's losing air.
I get it. And what about her vitals?
Heart's racing, oxygen levels are low, and her fingertips, they're probably turning blue.
That's not good.
No, it means her body's not getting enough oxygen, and it's starting to affect her circulation.
So this is serious.
Yeah, it is. Paramedics got to act fast. First, oxygen.
It's like that emergency lifeline, that medications, maybe Celbadone. Yeah, it's a bronchodilator, opens up the airway.
Oh, so that's the go-to for asthma attacks.
Usually. But in severe cases, they might need epinephrine.
Epinephrine?
It's like a supercharge,
Yeah.
Gets things moving.
Yeah.
Buys them time to get her to the hospital.
Wow. I'm already getting stressed just hearing about this.
Yeah, it's high pressure.
Okay, let's move on to our next case. A 25-year-old male, let's call him David.
All right, David.
He's just finished a basketball game, suddenly has this sharp chest pain, difficulty breathing.
Ooh, sudden chest pain. That's always tricky.
Yeah.
Could be a lot of things. But given his age, the activity, sharp pain, got to think about a collapsed lung.
You mean a pneumothorax?
That's the one, yeah. Like imagine your lung is a balloon in your chest, right?
Okay.
And it gets a tear. Air leaks out, lung collapses.
You can collapse a lung just from playing basketball.
It happens, especially in tall, thin people.
Huh, interesting.
So how would they know if it's actually a pneumothorax?
They'd check his breathing. They'll hear decreased breath sounds on one side, that collapsed lung, not much air moving. And his vitals, heart rate, breathing, skin color, all clues.
So what do they do? Like, can they fix it right there?
Not reinflate the lung on the spot, no. But they can give him oxygen, monitor him closely, get him to the hospital fast.
Okay, got it. Next up, we've got a 65-year-old male. Let's name him John.
John, okay.
Woke up with trouble breathing, history of asthma, and he's a smoker.
Ah, smoker. That adds other layer of complexity.
How so?
Years of smoking, it really damages the lungs,
Right.
makes them less efficient, like trying to breathe through a sponge.
Yikes.
Yeah, not good. So on top of asthma, you've got this underlying lung damage.
The case mentions supraclavicular indrawing.
Yeah, that's when the tissue above the collarbone sinks in when he breathes in.
Really?
It means he's using all these extra muscles, like in his neck and shoulders.
Wow.
To help him breathe.
So his body's really struggling.
Big time. It's like sending out an SOS,
Okay, moving on. We've got an 80-year-old woman, Mary.
Mary.
She collapses at a museum.
Sudden collapse, especially at that age. Gotta be worried.
Yeah, sounds scary.
First thing, paramedics assess.
Yeah.
Conscious, breathing, pulse.
Right.
Bystanders, they can be really helpful here,
How so?
They might know if she have any medical conditions, if there were any warning signs before she collapsed.
Okay, that makes sense.
Oh.
So she's confused, having trouble breathing, weak and irregular pulse, and there's swelling in her lower left leg. Is that important?
Swollen leg.
Yeah.
Especially in someone her age, could be a deep vein thrombosis.
Vein thrombosis.
DVT, blood clot in her leg. And that can be a big problem.
Oh, so
It can travel to the lungs, pulmonary embolism.
very dangerous.
So a blood clot in the leg can, like, move to the lungs.
Yep, blocks blood flow. Life-threatening situation.
Vitals aren't good either.
Yeah, high blood pressure, rapid pulse, labored breathing. She's in trouble. Okay, so what can they do?
Oxygen. Monitor her heart. Get her to the hospital fast.
Wow, it's like every second counts in these situations.
You bet.
Okay, last case in this set.
Yeah.
51-year-old construction worker. Let's call him Bill.
Construction worker Bill.
Difficulty breathing, productive cough.
Productive cough, huh? Means he's coughing up phlegm. So something's irritating those airways.
Yeah, the case study says he's got a weak and irregular pulse, labored breathing, and his extremities are cool.
Okay, so his circulation might be compromised. What else do we know about him?
Well, he's a construction worker, so I'm guessing his job might be relevant.
Oh, yeah, absolutely. Dust, fumes, all that stuff. It can really mess with your lungs.
So what are we thinking here? Like, what could be causing all this?
Pneumonia, bronchitis, could be a respiratory infection, could even be something like COPD or heart failure. Got to consider everything.
His vitals. Elevated heart rate, irregular pulse, low oxygen saturation.
Okay, so definitely needs oxygen, IV access for fluids and meds, close monitoring all the way to the hospital.
Wow. So we've gone from asthma attacks to potential collapsed lungs to possible blood clots.
Yeah.
It's clear that paramedics need to be ready for anything.
Absolutely. Quick thinking, thorough assessments, staying calm under pressure. It's amazing what they do.
It really is.
It is.
You know, these cases are just scratching the surface of pulmonary emergency.
Oh, yeah, there's so much more.
But before we get too deep into the weeds, let's take a step back and highlight some of the key things we've learned so far.
Sounds good. What stands out to you? For me, it's the assessment piece. It's crucial. They have to be like detectives, gathering all the clues, symptoms, history, vitals.
That's like a medical puzzle, but with like a time limit.
Exactly. And the pressure's on. I mean, even talking about these cases gets my heart racing.
Oh, tell me about it. I'm getting anxious just listening.
Right. But that's their job every day. And what's crazy is how different each case can be.
That's true.
Yeah.
We've seen sudden onset, like with David and his chest pain, and then gradual worsening, like Sarah's asthma.
Exactly. So many ways respiratory distress can present.
Makes you wonder how they even prepare for all that.
Well, you can't anticipate everything, right? But solid training, a systematic approach, that's key.
Yeah.
But one thing's for sure. No matter the cause, oxygen and medications are vital.
It's like their go-to toolkit.
First line of defense, stabilize the patient, get them to the hospital.
Makes you appreciate what they can do in the back of an ambulance.
Oh, kidding.
Speaking of those interventions, let's go back to Sarah for a second. Salbutamol and epinephrine.
Right.
What's the difference? When would they use one over the other?
Good question. So salbutamol, it's a bronchodilator, short-acting. It relaxes the muscles around the airways.
Okay.
Helps them open up, air flows better, like widening a road to ease traffic.
Makes sense.
It's usually the first choice for asthma attacks.
Okay.
Now, epinephrine, that's the big guns. It acts on the airways, but also the heart, the blood vessels.
Oh, wow.
Increases heart rate, blood pressure. You need that in those super severe cases.
Yeah. So it's about matching the treatment to the severity.
Exactly.
Now, with David, his collapsed lung, you said it's more common than people think.
Yep.
What else, besides those decreased breath sounds, would tip him off to a pneumothorax?
Good question. They'd check for tracheal deviation. That's when the windpipe shifts away from the collapsed lung.
Great.
Like a balloon deflating on one side pulls everything towards it.
Huh. Never thought about it that way.
And they check for subcutaneous emphysema.
Subcutaneous emphysema.
It's when air gets trapped under the skin. Feels crackly when you touch it.
Wow. So many things to look for.
It's all about the details. Now, John, the smoker with asthma, his case, it really highlights the damage smoking does.
Yeah, for sure. That supraclavicular indrawing you mentioned, that was a new one for me.
Oh, yeah. That's a sign he's working really hard to breathe.
Right.
Those muscles above the collarbones, they sink in when he inhales.
Wow.
Means he's using his neck and shoulder muscles to help pull air in.
Like his body's calling for backup.
Exactly. The main respiratory muscles are exhausted.
Okay, so back to Mary, the woman who collapsed at the museum. That blood clot, that was scary.
Pulmonary embolism, yeah. Very serious.
What are some things that increase your risk of getting DVT?
Well, sitting for long periods, like on a plane or after surgery, that's a big one.
Right, so those airplane exercises are actually important.
They are. You got to keep the blood moving. Other risks, medications, smoking, obesity, family history.
Oh, wow, so many things.
It all slows down circulation, makes those clots more likely to form.
Got it. And last, Bill, the construction worker. His case really shows how our jobs can impact our lungs.
Yeah, environment plays a huge role. For those in similar professions, protection's key.
Like wearing a mask, things like that.
Exactly. Masks, respirators, anything to minimize exposure to dust, fumes, all that stuff.
Makes sense.
And regular checkups. Catch things early.
Prevention is key, right?
Always.
Okay, so much to unpack here. These cases, they're complex. And paramedics, they're incredible.
Truly are. On the front lines, making life-saving decisions every day.
But there's another side to this we haven't really talked about.
Oh, what's that?
We've talked about, the medical stuff.
Mm-hmm.
But what about the paramedics themselves?
Oh, yeah, that's important.
I mean, they see a lot of trauma, a lot of suffering.
It takes a toll, that's for sure.
What kind of impact does that have on them, emotionally?
Well, these are, real people dealing with intense situations day in and day out.
Yeah.
The emotional burden, it can be heavy.
Right, because it's not like they can just, switch it off at the end of their shift.
Exactly. It stays with you. You see someone fighting for every breath. It's hard not to take that home.
But what are we doing to support them?
Well, that's a good question. But we got to start talking about it, right?
For sure.
Compassion fatigue, burnout, these are huge issues in this field. They're giving so much all the time.
It's like they're the ones who need rescuing sometime.
It's true. We got to make sure they have access to mental health resources, Debriefing sessions after tough calls, a supportive work environment, it all matters.
It's true. We need to take care of those who take care of us.
Absolutely. It's about recognizing them not just for their skills, but for their resilience.
These cases, they really highlight that.
Yeah.
Paramedics, they're heroes.
No doubt about it. Putting themselves out there every day.
This whole deep dive has been eye-opening. I feel like I understand pulmonary emergencies so much better now.
Me too. And it makes you appreciate those on the front lines even more.
For sure. It's not just about knowing the right treatments. It's about quick thinking, compassion.
Mm-hmm.
And I think, if our listeners take away one thing from this,
Yeah.
it's that even a little bit of knowledge about respiratory distress can make a difference.
Absolutely. Recognizing the signs, knowing when to call for help, it can be life-saving.
Okay, I think it's time to wrap up this deep dive.
Yeah, we've covered a lot.
It's been intense, informative, and, inspiring.
I agree. A real privilege to share these stories.
So, to everyone listening, thank you for joining us. Keep learning. Keep asking questions.
Keep those brains engaged.
And remember, if you or someone you know is experiencing respiratory distress, don't wait. Call for help.
Couldn't have said it better myself.
Until next time, stay curious, stay informed, and thank you for being part of the deep dive.
It's been a pleasure. See you all next time.